cannot believe that I've been a GP for 5 years. The time has absolutely flown by. I think overwhelmingly the reasons that I came into general practice are still with me. So I love coming to work in the morning. I work with a brilliant team of people. I love the variety of patients that I see on a day-to-day basis, and I really enjoy not knowing what's going to come through the door on any given day. I think being a GP gives you the opportunity to become a real member of the community you're working in. You're looking after patients and their families from the moment they're born until the end of their lives. So I can come into work one day and do a newborn baby check in the morning, and then my home visit may be a palliative case where I'm going to care for somebody at the end of their life. One of the most satisfying cases I've been involved with recently was actually a lady who I diagnosed unfortunately with a cancer, but actually got to know her family inside out during the few months after that, and actually was with her at the time she died at home. I'd been involved in all of her kind of medical care, but also a lot of the pastoral care, and worked really closely with the Macmillan nurses right to the end of her life, and her family still come and see me now and remember me as that doctor, and I think that's a huge privilege and something that I find very satisfying. I think there are lots of changes afoot at the moment in general practice, and one of the biggest things is that the government are trying to move lots of secondary care, so hospital-based services, into primary care, into the general practice setting, which has massive benefits, I feel, for the patients. They're going to be coming to the place that they know and feel comfortable for lots of those kind of treatments and services, rather than having to park, sit in hospital waiting rooms, etc. And a lot of it will be delivered by us, the people they know and trust. I think the difficulties that we face as general practitioners is actually having the capacity and the resources to provide that in the way that we would like it to be provided, with the standards that we set. So we're trying to utilise the team that we have here and specialties that we all might have to do that. For example, one of our GPs is an ex-orthopaedic surgeon, so he's taking on the role of doing lots of our joint injections. He also does a lot of minor operations in the surgery, which is a fantastic facility for patients. Most of the female GPs, we tend to provide family planning and gynecology based services, and more of that is moving into primary care. And we also have a doctor who's done a lot of cardiology, so we have specialised ECG, heart monitoring equipment and things like that here, which does negate the need to refer lots of people to the cardiologist in the hospital. So I started here 5 years ago as a salaried GP, and now I'm lucky enough to be a partner in this business. I think the main differences really are, as a salaried GP, you're an employee, so you work to the terms of a contract. You see certain numbers of patients, you do certain numbers of home visits. Once you finish your work for the day, you go home. And that has its attractions. However, now as a partner in this business, I am a partner in a business. So as well as being the doctor, I also have to take on certain managerial responsibilities, have to look after our various members of staff, and I'm much more involved in satisfying our GP contract. The latest version of that was set out in 2004, and our practice is what we call a GMS practice, so we're one of the practices that signed up to that contract. And basically it means that we have to provide a set number of services, and we get paid for each specific service that we provide. And each year in April we have to submit our kind of records to be judged on whether we've actually reached those appropriately, and we get paid accordingly. The perfect GP, that's a difficult one to answer. I think there's lots of attributes that are ideal for the general practice setting. I think you need to have a love for the job, and you need to be enthusiastic about it. You know, there are some tough times at the moment for general practitioners, but if you love the job, then you don't mind the change, and you kind of embrace the change and look upon that change as a positive thing. I think you really need to be organised and learn how to manage your work-life balance and just time management at work. there is lots of paperwork, there's lots of things that have to be filled in, boxes that need to be ticked these days. And you've obviously got to balance all of that with providing an excellent service for the patients. So being organised is paramount, really. And I think you just need to be approachable. I think most patients, if you ask them, who do you like seeing, they tend to talk about the doctors that are approachable and easy to talk to, and I think that's key. So I think anybody with any questions in their mind about general practice as a career really ought to get out here and experience it firsthand. And obviously, as a trainee doctor, you can have that opportunity as part of your foundation programme, which I would encourage everybody to take up. But if you're beyond that point and aren't sure whether a change is right for you, then come out and experience it. We have students here, trainees here all the time. We thrive on having new blood and fresh people around. And I think most surgeries would agree that only does good. So contact your local surgery, ask them for some experience and get out and experience it for yourselves.